Hello everyone, this is Dr. Sarosh Siddiqui from the platform of UKMLA with DSS. So let's just continue our ethical sections, and the topic that we're going to discuss today is the non-accidental injury. Okay, so the non-accidental injury is also a kind of an abuse, but the reason why we are doing it separately is because the structure and the format that you need to follow in cases of a non-accidental injury is very different from what you would follow in a typical abuse station. Okay, so you need to realize that the non-accidental injury would typically be occurring in the vulnerable group of the society, and the vulnerable group of the society is basically the pediatric group and the elderly group. Okay, so the typical case of the non-accidental injury would present in a way that a child or an elderly person, they would be accompanied either by their mother or their daughter or the son, and they may have some sort of injuries involving the bone. So they may just have some fracture, or they may just have some orthopedic injuries with which they would be presenting to you, and they may just present to you in the A&E, or most likely in the A&E. Okay, and there would be a few things that would be pointing towards the fact that okay, this type of injury cannot be an accidental injury, and this type of injury cannot just be because of an accident. Okay, so what are the key pointers that you need to identify and then you need to realize whenever you are dealing with a non-accidental injury? It is number one that the injury, the mechanism of the injury, okay, would not be relating to the severity of the injury by which it is being presented. Okay, let's suppose that if the mother says that my child just fell down from the sofa, or my child just was just playing on the bed, and he just fell down while playing on the bed. Uh, just falling down from the sofa, or just falling from a very small height, that is the bed, wouldn't cause such a severe injury like the spinal fracture, which is there in this particular case. Okay, spinal fracture is a kind of a fracture we know that it occurs when a lot of injury, a lot of force is applied to cause that particular injury. Okay, so you would understand that okay, the mechanism of the injury and the severity by which the injury is presenting, these two things are not correlating. Okay, other than that, what you would also realize that there would be a delayed presentation. Okay, so when you're doing your data gathering, and when you ask them, and when you inquire about the fact that okay, when did this happen, and when did Joshua fall down, or when did your mother, or when did your father slipped in the washroom? Okay, so they would say that yeah, doctor, it happened 2 to 3 days ago. Yeah, doctor, it happened one night ago. Yeah, doctor, it happened a week ago. Okay, and there would be a delayed presentation. Okay, um, and this is something that points towards the possibility of a non-accidental injury, because if this injury would have happened by accident, they would have just brought their child, or brought their mother and father to the A&E immediately, or just within a couple of hours. Okay, but if there is a delayed presentation, then this should ring some alarms in your head that okay, that it might be um, because of an abuse, or it might be the non-accidental injury. Okay, apart from that, there are a few risk factors, okay, that you need to ask in the data gathering once you get the idea that okay, this is something that is not all right, and there's something fishy going on, and then you would have to ask about the certain risk factors of the non-accidental injury to further solidify the idea of abuse in your head, and come to the diagnosis of non-accidental injury, instead of just coming to a diagnosis of a regular fracture that may just have happened because of an accident or because of an incident. Okay, so there are certain risk factors that you need to have in your mind. Okay, so once you have got all of these things in your head, now we can begin the structure. Now we can begin with the lecture on how and what approach you should take when you are dealing with the non-accidental injury cases. Okay, so after you're done with the introduction and rapport building, okay, you're going to inquire about the history of the fall, or the incident history, basically, that how did Joshua fell down, or how Did your father fall down? When did it happen? Can you please tell me from how much height did your child fell down? Okay, he fell down from a sofa. How high was the sofa? Yeah, doctor, it was just 2 to 3 meters on the height. Okay. Then what was Joshua doing before the fall, or what was your father doing before the fall? Uh, then after the fall, what did you do after the fall? Did you take Joshua to a hospital? Did you give him any painkillers? Did you assess the kind of injury that Joshua may have had? Okay, and when you're inquiring about these things, you would realize, and then you would find that okay, there is a delayed presentation. Okay, when you would ask this question, that can you please tell me when did the fall happen, or when did this particular incident happen, who witnessed the incident? Okay, uh, so you'll find out that okay, there is a delayed presentation. Okay, the incident may have happened 2 days ago, the incident may have happened maybe 12 to 14 hours ago. Okay, so you're going to ask any particular reason why there was a delayed presentation. That means any particular reason why you did not bring Joshua to the A&E right after he fell down, or why you didn't bring your father to the A&E right when he fell down. Okay, and then they'll just come up with a very lame excuse that okay, no one was there to drive me. I was busy. I had a work meeting, and I did not feel that there might be a very strong uh, injury that might have happened to Joshua, or I did not think that this thing might be so severe that my child would remain in pain. Or they would say that okay, I just planned on bringing Joshua to the A&E, but it just kept on slipping my mind. It just slipped my mind. Okay, so you would not get a very confident answer when you ask about that why was there a delay in bringing your child or bringing your patient or to the A&E, or to why did you do some delay to seek medical help. Okay, so that is what the history of fall is. Okay, so till here you would get the idea that okay, like this is a non-accidental injury case. Okay, then, even though in layer number one, you got the idea that this is a non-accidental injury and this can be a form of abuse, you do not just directly jump on to the risk factors of the abuse. Okay, what you need to do is that you need to do the P bind when it comes to the child, and the meftosa in elderly. Why? Because if you directly just jump onto the abuse, number one, you'll sound scripted. Okay, and number two, you would take the patient or take the relative, at a back step, that okay, directly that you're coming to the abuse topic. Okay, so you don't want to come directly to this particular topic. Okay, uh, just do the P bind in the child and do the meftosa in the elderly, and just do it very briefly. Okay, you don't need to go into a lot of detail of the P bind and the meftosa, because there is a lot of other things that you need to do. Okay, so that is what the layer number two is. Okay, now the layer number three. Okay, now this is the most important layer. This is the most important layer. Okay, when it comes to abuse, and when it comes to the data gathering in the non-accidental injury case. Okay, so you got to assess what's the situation, what is going wrong. Okay, so you got to ask them that number one, who is at home, how are things at home, who lives with Joshua, who lives with Mr. Adam. Okay, so you're trying to assess that what is going on their home, in their home, and who are the people that interact with this particular patient. Okay, and once you got the idea of it, okay, that there is only one person living, there are two people living. Okay, then you ask about the risk factors of abuse. Okay, and you need to write these things down, and you need to remember all of these things, because you need to ask each and every risk factor of abuse. Okay, because anything can be the reason why the people in the house are behaving like this to a children, or like this to an adult. Okay, so ask about each and every stresses. Okay, that is there any emotional stress that you are going through. Okay, then ask about that are there any financial issues that you may be facing, that you may be having. Okay, and then talk about alcohol. Okay, that by any chance is anyone doing alcohol, or is anyone taking alcohol very frequently, or is anyone a chronic alcoholic in the home, okay, that may be a reason for child abuse, or that may be a reason for elderly abuse, okay. And then you want to ask about that, by any chance does anyone smoke, okay. And very very important thing, by any chance does anyone in the home do some IV drugs, okay. So like these are the risk factors. There are the few risk factors that are like really really important, okay. Then you got to ask that, okay, if they are the biological mother or the biological father or the biological daughter or the son, okay. You got to see that if they are related biologically to that particular patient or not, because if they are not biologically related, okay, then there is a higher chance that they may be abusing, or somebody who is not biologically related to the patient and they are living at home, they may be abusing the elderly person, or they may be abusing the child, okay. So you need to check that whether or not they are related by birth or not, okay. And in case of the child abuse, okay, just in the case of child abuse, what you need to do is that you need to see how was the pregnancy, okay. Did you have any difficulty in pregnancy? Did you have any complications in your pregnancy, okay. And then you also got to ask that, is the child planned or is the child unplanned? And why are you asking these questions? Because the mothers who have had a difficult pregnancy, they tend to abuse their child, okay. And the child who is not planned, okay, they may be abused either by the mother or by the father as well, okay. So you need to ask about these factors, and you need to make sure that you have covered each and every angle, because any of the 8 to 10 different reasons of abuse that I mentioned, anything can be the cause. And if you don't ask all of these questions, you may just miss out on the reason why this particular patient may be getting abused, okay. Now, before moving on to the layer number 4, one very important thing that I would like to talk about in the layer number 3. So you see that these are like really personal questions, okay, and these are like really intrusive questions as well, okay. uh, at this point, when you start asking these questions, okay, the relative, or the mother or the daughter or the son, they may just stop you over there, and they may just say that, doctor, why are you even asking these questions? My child just had a fracture, my just child just had an injury, or my father or my mother, they just had a fall. uh, just talk about that, just manage that, just like do your job, and just help my father and help my child regarding the situation that they're having. But why are you asking these personal questions, okay? So they may just stop you, okay. So how you can prevent that? Number one, do an aggressive signposting when you are beginning this particular layer, okay. uh, you can say that, okay, so Mr. Mrs. Anna, just to ask a couple of personal questions, and they're important for my consultation, because that will help me understand a few situations much more better. So will it be okay if I can just ask you a few personal questions, okay? So you do the signposting, okay, and then start asking all of these questions. And if in the middle, if they try to interrupt you, and if they don't answer these questions to you, then again you are going to try to make them convinced, and try to make them agree to allow you to ask these questions, by saying that, yes, Miss Anna, I do understand that you are really worried about your child, and you really want us to treat Joshua as soon as possible. I would like to tell you that he's in the safe hands right now, and the treatment will begin as soon as possible. But in order to make sure that I treat Joshua correctly, and we manage Joshua's condition in the best way possible, these questions are very important for my consultation, okay. So make sure that you are aware of these tips and tricks to um, ensure that you are able to ask about the risk factor, because this is a challenging part, this is not an easy part, okay. And you may just get some resistance till this point, okay. So once you're done with this, okay, once you have asked about all the risk factors, and once you have explored like all the different possibilities, and all the possible risks that may be associated, and that the reasons that the child or the elderly may just get abused, then you try to come to the point, okay. and then you just try to make them open up. Okay, and you need to do this in a very very smart way. Okay, you need to do this in a very very smart way. Okay, and there's a very important thing that comes with this that I'm going to talk about. So just say that, okay, thank you so much, Miss Anna, for answering all my question. I understand that taking care of an elderly or child can become a bit overwhelming, okay, or it can become a bit stressing, and sometimes it can lead us to act out of character. Okay. So by any chance, do you think that this particular injury might be caused by someone else, and it may not just be an accident? Okay. So just this thing. Okay. And be mentally prepared. Okay. By saying this thing, okay, you may just trigger the mother or the relative that is there to have a chat with you. Okay, they may just get angry. Okay, they may just get annoyed. Okay, so do not start forcing on them that, okay, you need to accept that, you need to say that you have done the injury, you have caused the injury, or someone in your home have caused the injury. Okay, why? Because this is the problem. Again, this is what most of the candidates make the mistake. Okay, they start to act like a lawyer. Okay, and you need to understand that it's not your job to make them verbalize this thing and make them agree that, okay, they have abused the patient or someone in their home have abused the patient. Okay, that is not your job to do so. What most of the candidates do, that when they come to this layer, this is something that is there in their head, that, okay, I need to make them agree, and I need to get this out of their mouth that yes, they have abused the patient, or someone they know, or someone from their family have abused the patient. Okay, that is not your job. Okay, your job as a doctor in the NHS, as an FI2 in the NHS, is just to identify. Okay, is just to identify that there is some kind of abuse, or there is some kind of non-accidental injury involved. Who has done it? It's none of your concerns. Okay, yes, you should develop some kind of idea that, okay, the mother may be abusing, or the husband may be abusing. Okay, or the aunt or the caretaker who takes care of the child, or the who takes care of the elderly, they may be abusing. Okay, that is something that needs to be there in your mind. Okay, but you are not supposed to interrogate the relative on this, that, okay, by any chance have you done it? Okay, just once is fine, because you need to come to the topic. Okay, you need to take the consultation, you need to drive the consultation in the direction of the non-accidental injury. Okay, so just once is fine. Okay, but if they don't, okay, then do not force them. Okay, do not force them. Okay, now, since you've said this, okay, there are two possibilities. As if you've just mentioned it, if you just try to drop the hint that, okay, something may be wrong. In layer number 5, they may just open up. Okay, they may just agree, and they may just say that, yeah, doctor, sometimes I kind of feel overwhelmed, and since Joshua was an unplanned child, I don't really like him, and that is why I kind of was a bit harsh to Joshua, and I just pulled him very hard because I was really annoyed at him. I wasn't able to sleep, and he was constantly making some noises, so I just hit him. Okay, so they may just agree. They may just open up. Okay, and this is something that is going to happen rarely, that they open up in layer number 4. Okay, so this is something very very rare. Okay, that they open up. But if they open up immediately right after the layer number 4, okay, then you just explore the abuse. Okay, that how many times has it happened? Can you please tell me why did this happen? Anything that you used to harm Joshua. Okay, and any particular reason why you might be acting this way, and how, and like what are the other mechanisms you have used to harm Joshua in the past. Okay, so you can just explore the abuse. But let's say that if uh, if they don't open up in the layer number 4, which is the most likely thing. Okay, then what you need to do is that you need to use the scare approach. Okay, again, the scare approach is not there to force them to open up. Okay, it's not there to interrogate them. It's not there to come to the point that they start agreeing on what you have done and what they have done, and they start accepting that it's their fault, or it's someone's who's living in their home, it's their fault. Okay, but you need to take the station forward, and you need to come to the main point. Okay, and you need to explain it that okay, this is something that is fishy. Okay, and how you're going to do that, there's a very smart way to go about it. You're going to say that okay, there is a difference in the nature of injuries in your patient is presenting, and it usually happens whenever there is a form of an abuse. Okay, and when you are saying this, you need to be very confident. Okay, you need to be confident in your approach, and you need to say that okay, the kind of injury that Joshua is presenting and the kind of chat that I have had with you, this type of injury doesn't happen by accident. Okay, and the kind of force that is required to break the bone, like the way it is broken in Joshua's case, it is most likely due to an abuse. Okay, and then you need to have a very defensive approach right after confidently explaining that well, I'm no one to judge. Okay, and I'm no one to blame anyone. Okay, and it's not my duty, and it's not my responsibility to interrogate anyone and to judge anyone, or to blame anyone. But as a doctor, I'm really concerned about the safety of your patient. Okay, and as a doctor, it's my legal it's my responsibility, it's my ethical, and it's my legal responsibilities to make sure that the patient is safe, and to make sure that Joshua is completely in the safe hands and nothing is wrong with Joshua. Therefore, I may just have to involve the relevant authorities. Okay, so now what you did, you just came out very clean. Okay, you did your part. Okay, your part was to identify this thing as an abuse. Your part was to confidently explain it as abuse. Okay, your part was to identify the risk factors and identify the nature of the injury and label it as abuse. Okay, and you did all of this thing. And just by saying that I'm not anyone to judge. Okay, and I'm not here to interrogate, I'm not here to blame or pinpoint everyone, but Miss Anna, or Miss whatever the name of the mother is, the kind of injuries that your patient is presenting with, it happens really that it can happen because of an accident. Okay, and it seems as if there might be a violent approach taken. As a result, I think that your child may be under the influence of abuse. I'm not saying who did it. I'm not commenting on who did it, whether you did it or someone else did it. I'm no one to blame. But as a doctor, it is my responsibility to make sure that everything is safe with Joshua. And therefore, I would have to involve the relevant authorities. Okay. So if they don't open up, you gotta use this way. You gotta do it this way. Okay. Uh, and then again there would be two options. Okay, either they accept, okay, that yes doctor, I'm really sorry, I was hiding it, and I was very overwhelmed, and I basically acted out of character, and I harmed and I did this kind of thing to my kid, and I'm really guilty about it. Okay, and if they do, then just explore the abuse that I just mentioned, that how you're going to explore the abuse, and how many times it happened, why did this happen, anything else that you did to harm, any other mechanism you used to harm your child or harm your parent. Okay, and if they don't, okay, let's say that they don't want to open up. Okay, then just move on. Okay, just move on to layer number 6. Okay, do not, again as I mentioned, that do not keep on forcing them to open up, and do not keep on forcing them to agree that okay, yes, I have done the abuse. Okay, if they do it, then fine. Okay, then you can explore the abuse. Okay, but if they don't, then don't waste your time, and don't ruin your station by forgetting what your job is, by forgetting what your limitations are. Okay, what your responsibility as a doctor are, you've already done that in the data gathering. Now it's your responsibility to be the doctor first, and treat Joshua as a patient, okay, or treat that particular patient that is there in the A&E to seek your medical help first, okay, and then comes your ethical consideration, okay. So the layer number 6 is very important, okay. You need to medically manage the patient, and you need to make sure that you are verbalizing the medical management. What a lot of people they do is that they completely miss out on the medical management, because they're so concerned about the ethical consideration, they're so concerned about the social services, they're so concerned about being a lawyer and interrogating that who did it, when did this thing happen, have you done it before as well. They don't want to answer that question, and frankly speaking, you're not even the right person to whom they should be answering all of these things. You're just a doctor, okay. Your responsibility was just to identify this thing as an abuse and just report to the authorities, okay. Do not get into so much detail so that you end up missing out on the important things and missing out on the important medical management pointers, okay, because that is what your job is, and that is what will give you more marks as compared to just making them open up and making them agree that okay, they are the abusers, or somebody in their house is abusing the child, okay. So just focus on the medical management. That is for every case you're going to admit the patient, okay. Then you need to do the skeletal survey, okay. And since there is fracture involved, there's an injury involved, I'm pretty sure that the patient is going to be in some pain, so you need to start on the painkiller medications, okay. Then you may need to repeat the x-rays, okay. And you need to take the orthopedic surgeons on board, and then you need to say that okay, the orthopedics are going to come and assess your patient, and if there is a need, they may take the patient for a surgery to repair the injury that may have been caused by whatever means that you just shared with me, okay. So do the complete medical management: admission, skeletal survey, painkillers, x-ray, orthopedic review, and of course it's not mentioned over here, but such a case it does require involvement of the seniors as well, okay. So make sure that the seniors uh, get involved in it, okay. So do the medical management first, okay, and then once you're done with the medical management, okay, then you can come to the ethical management and say that it is something that is completely illegal. The nature of the injury that I talked about, as I mentioned, that I'm suspecting that the child may be under the influence of abuse. And let me tell you, Miss Anna, it is something illegal, and it is my responsibility to inform the social services. Okay, and then explain what the social service would do. The social service will come and talk to you and assess if the patient is safe at home. So you see, when I was on the layer number 5, I did not use the term social service. Why? I just use the term relevant authorities. Okay, the legal is written over here, but I would advise you not to use the legal authorities term, because that would unnecessarily trigger the mother, or that would unnecessarily trigger the son or the daughter. Okay, just use the term relevant authorities. Be it diplomatic. Okay, I haven't said social service over here. I am using the terminology of social services on the layer number 7 at the very end, because I know that this is going to trigger the mother or trigger the daughter. Okay, that why do you want to involve the social service? I don't want the social service to be get involved. I know the social service will come and they will take away my child, or they will take away my father and my mother from me. They're going to make some legal complaints against me, and I'm going to get into trouble. I would have to face the legal authorities. I really don't want that to happen, okay. And all of these would be the concerns that they would be like dropping to you, okay. And then you just have to be diplomatic, and you just say that it's my responsibility, Anna. It's my legal and it's my ethical responsibility as a doctor to involve the social service, and if everything is safe, okay. And if I hope, if I am wrong, that if this is not an abuse, then the social service would not do anything, okay. They would just make this case clear, and they would just leave, and nothing would happen. You can take Joshua with you, or you can take your father with you, and you wouldn't have to face any legal authorities, or you wouldn't have to face uh, any sort of legal obligations. Okay, so just say that okay, this is your responsibility, and it is important for you to involve the social services, and it's not something that you are personally doing, or it's not something that you're doing out of judgment, or just because you want to blame someone, but it's just that you feel that okay, there might be something wrong, and you're just concerned about the safety of the child. Okay, and when you keep on saying this okay, I'm concerned about the safety of your child, and I'm concerned about the safety of your child, then there's a very strong possibility that they might just say that okay, I feel that my child is not safe with you over here, because you're not making sense, because you're not saying the right thing, and I just want to take Joshua home. I just want to take my father home, and I don't want to get treated. Okay, uh, to this question, you gotta say that okay, you can unfortunately, Miss Anna, I really respect your wishes, but we cannot let you take Joshua until Joshua is cleared medically by the medical team, and until the social services come and assesses the situation and clears your kid. So until that, you cannot take your child home, and I'm really sorry. I do respect your wishes, but please try to understand that this is a part of the medical consultation, and this is part of our ethical and our legal responsibilities as a doctor and the medical team. So we would have to involve the social service, and we would have to treat Joshua nevertheless, because the NHS and we are like, and the medical team is really really concerned about uh, your child safety. So trust me on this, everything is going to be okay, everything is going to be clear. We are going to make sure that Joshua is completely fine medically, and just the social service would assess the situation, and make sure that the Joshua remains fine throughout. Okay, and this is how you have to tackle it, and this is how you would have to defend this particular diagnosis and defend the entire situation. Okay, so do not get stressed. They would give you a difficult time. They would not be very easy. Okay, and it's unlikely that they accept that they have done the abuse. So this part is something that very rarely you would be doing. Okay, most of the cases, okay, you would be just defending your diagnosis. You would be just playing safe and playing very diplomatic, okay, in a very confident way. Okay, that is what you're going to do. And then, as I mentioned in the layer number 8, they may just throw some concerns, like the concern about the social service that I talk about, that will they take my child. Just reassure them, no, this is the last thing that they do, and they're just going to make sure that everything is right with your child. Okay, and let's suppose if they've agreed that okay, they were the abuser or someone else was the abuser. Okay, and then they may just give you the reason that yeah, doctor, I was stressed, that's why I did it. So just refer them to CBT. Okay, if they are having mental stress, if they are having mental health illness, refer them to the CBT. And then if they say that doctor, I was drunk, then refer them to alcohol cessation clinic. Okay, so the concern depends on case to case, that what was the reason for the abuse, and whether or not they are agreeing that okay, yes, they did abuse, or somebody did abuse the child. Okay, so it really depends on scenario to scenario. Okay, but make sure that you are not saying anything, you're not being a lawyer, and you're not starting to interrogate. Number one, you're not being judgmental, and number two, you're not playing the blame game. Okay, that you have done it, or your partner have done it. Okay, you just say it once in a very diplomatic way, in a very nice tone, that somebody may have done it. Like, is there a possibility that you or someone else may have acted out of character? Just this time, okay, just this once, you need to say this thing, only because you want to come to the topic. Other than that, do not be a lawyer. Okay, do not try to become a member of the social service. Okay, you are an FI2 in the ANE. You're not an FI2 in the social service, or you're not a representative in the social service. Okay, so make sure that you are aware of these things, you are aware of these tips and trick. Okay, and make sure that you are following the structure, because this type of station can get really tricky, and it can get difficult to manage, and difficult to control. Okay, so yeah, That's pretty much it from my side. If you've got any questions and any queries regarding the non-accidental injury, then please drop them down in the comment box below or drop them down in my social media. I'm going to address all your concerns, whatever the concerns are dropped over there. And if you want a one-on-one walk with UKMLA with DSS, then scan the QR code for more details. That's pretty much it from my side. See you in the next lecture.